Pregnancy Show, everybody. I'm Melanie Raposo, and right now I'm at the SWCH Fertility Center, and I'm talking to Dr. Liebrecht again, and today we're talking about infertility, and we have something very special for you viewers today. We have an exclusive look at an actual egg being fertilized. You don't want to miss this.
There are many causes of infertility, and we say that about 60% of the causes are due to the female and about 40% due to the man. Sometimes there's problems with both of them that also overlap that. So in the female, we look at where the problem may lie in terms of the egg. So they has to produce an egg in order to ovulate and make a baby. The other thing is then the egg has to go through the fallopian tubes and travel into the uterus. So the tubes have to be open in order for someone to get pregnant. She has to have a uterus that's capable of carrying a baby, and also the sperm have to get to the right place at the right time. And then when we look at the man, he has to have enough sperm to be able to fertilize an egg and get up through the tubes and then ultimately produce a baby.
There are a variety of infertility treatments available, and they can range from the lower tech treatments, such as medications to stimulate the ovaries, to procedures that can unblock the fallopian tubes if necessary. For more serious fertility problems, there are the higher tech treatments, such as in vitro fertilization.
So in vitro fertilization, or as it's called IVF, is where we take the eggs out of the woman's body. So we have to make her produce lots of eggs. We extract those eggs from the body, and we use an ultrasound machine like this to do that. And then we take the eggs and we put them into dishes, okay? And basically in those dishes, we then fertilize the eggs. And we now can enhance fertilization when theoretically let's say there's a low sperm count. We can then take sperm and actually place it right into the egg. And that's called ICSI. And then we create these embryos that grow inside the laboratory, and then we can place some of them back into the woman. And not only that, but we can freeze the rest of them, keep them almost forever until the person's ready to have another baby or another try if it doesn't work.
Dr. Liebrecht says that while undergoing these fertilization treatments, one of the things women need to be prepared for is the possibility of having twins or even multiple births.
Now, luckily, most of those multiple births are just two babies, okay, and so twins. Very rarely, sometimes we will have more than two, and in those cases, we have to counsel people about whether they do something called selective reduction, where they only carry two, so for the safety of the mom.
Now, there are certain things you can do to prevent fertility problems, such as avoiding excessive drinking and avoiding smoking and drugs. But one of the biggest ways, as Dr. Liebrecht tells us, is having children sooner than later.
As a woman gets older, one of the things that happens as women get older is a change in their eggs. So women, as they age, and especially starts to happen after 30, and then at 35 it gets even more intensive, and after 40 it's a very big change in the ovaries. And what happens is the eggs become more abnormal. They change, they become genetically abnormal, and many of them are incapable of producing a baby. So that's why women, when they get older, even if their periods are still there, have a much, much lower chance of getting pregnant and a much higher chance of miscarrying, losing the baby because the eggs were abnormal, and a higher chance of having a baby that might be abnormal, which we can test for, but we don't want to be in that situation.
For more information about infertility, visit thepregnancy.show.com.